My name is Lauren Summers. I'm a third-year resident here at UW-Madison. I grew up in Janesville, Minnesota, which is a small farming community. And I went to University of Wisconsin-Oshkosh for undergraduate, and then back over to Minnesota at the University of Minnesota's Duluth campus for medical school. The biggest factor for me in picking UW-Madison to do my orthopedic residency was my away rotation here. I came here and rotated on the foot and ankle service, and I just got to meet so many attendings and residents and see, one, how great the training was here, and then two, just how happy and excited the people here were about education and orthopedics and taking care of patients. The day that I matched here at UW was such an exciting day. There's all this buildup, and I had really wanted to come here, and so I was just absolutely thrilled to match here. I got to share that moment with my best friend, who was also matching to one of her favorite programs in Wisconsin. Academically speaking, one of my favorite things about UW-Madison is the varied support for research. We are a big university hospital, and so if you want to do really impactful and interesting clinical or basic science research, we have the resources for you to do that here. But if you want to do more, clinically driven, focused research, or you're maybe not as interested in research, there's still support to do those things here. Clinically speaking, we just have the right mix of patients. We're a level 1 trauma center, one of the few level 1 trauma centers in Wisconsin. We also see a ton of bread and butter, things like hip fractures, tibial plateaus, and so we frequently have residents go into general practice because they're so well trained and they want to get back to a rural community. We all know orthopedics has historically been a very male-dominated field, and while the numbers of female residents, female attendings are on the rise, we still haven't caught up to other subspecialties yet. We're really fortunate here at UW-Madison that our program director is a woman, and now we have also appointed a woman to our chair of the department. So we have kind of that strong female leadership from the top down. We have about 30% female residents, which is some of the best numbers you'll see. Being a female resident is just kind of a non-issue. Nobody thinks about it. Nobody's going to bring it up. You're just treated like every other resident. Here at Madison, we have a strong sense of camaraderie among the residents that comes through in activities outside of the hospital. We get together, we like to go to breweries or out golfing or to concerts, but we also take care of each other in the program too. Last year we had 5 residents have babies, and we all just took care of each other and made sure those new parents could have time at home with their kids, but that nobody else was being neglected or taking on undue call burdens. This is just a community of people who are going to care about each other. One of the things I was most surprised about is that I knew coming in that the residents here just seemed so happy. They really liked their job. And I think there was a part of me that still was a little skeptical when I came here, and then to find out it was true. It just carried all the way through. People are excited to come to work. They like taking care of their patients here. They like working with their coworkers, and they still like learning. I absolutely love living in Madison. For me, it's got that perfect feel where it's not a massive metropolitan, but it's big enough to have all the things I want to do. I love golfing. Madison has a ton of golf courses here. I'm a big Broadway fan, and we've got the Overture Center that still gets off-touring Broadway shows. To someone who's thinking about coming here for residency, I would, without reservation, tell them to come here. I think it's a great program with fantastic people. You'll be well trained. You'll have a good time. You'll leave here with bonds with your co-residents for forever.